Great. So I can just introduce myself real quick. My name is Brenda Lee Viveris, for anyone that doesn't know me. I am from the Rhode Island Department of Health. I'm the chief of the Center for Food Protection, and I will let the co-chair introduce herself as well.
Thanks, Brenda Lee. Good afternoon, everybody. My name is Karen Blickenstaff. I am a co-chair along with Brenda Lee for the Foodborne Outbreak Emergency Response Committee here at AFDO. And then in my day job, I am the response staff director at FDA's Coordinated Outbreak Response and Evaluation Network.
And then I also just mentioned that Pat Kenley is our AFDO liaison, who's always been great and helps us put a lot of this together as well. So shout out to him. We have some really great speakers today. So I'm going to go ahead and introduce the first speaker. So our first speaker today is Megan Holst. Megan is an epidemiologist at CDC in the National Center for Environmental Health. She has worked in food safety since 2017. She's also done some work in emergency response operations and wastewater surveillance. She currently manages a foodborne illness outbreak surveillance system in various environmental health studies. And today she'll discuss some environmental health data from the foodborne outbreak surveillance system. So thank you, Megan. If you want to go ahead and share your screen for your slides, feel free to do that.
Yes, okay, I will share them now. Okay. Can you see them, Brenda Lee?
Yes, thank you.
Well, hi, everyone. Thank you for having me today. Like Brenda Lee said, my name is Megan Holst. I am with CDC. I am housed in the Division of Environmental Health Science and Practice in the Food, Water, and Environmental Health Services branch. So today I'm going to go over some environmental antecedents, also known as root causes of foodborne illness outbreaks. So I'll present some of the environmental antecedent data, but first I'll start with an introduction to the concept and then explain how we collect this data. Okay, so the National Environmental Assessment Reporting System, also known as NEARS, is managed by my team at CDC. It was launched in 2014, and it collects environmental assessment data from foodborne illness outbreaks at retail food establishments. State and local health departments voluntarily report to NEARS, and last year in 2022, we had 29 sites, and they're from all around the country, so we have a pretty diverse selection of health departments. And so the NEARS data is used to inform and improve investigation and prevention efforts. A lot of you might be familiar with NORS, which is the National Outbreak Reporting System. All state and local health departments report to NORS, their foodborne illness outbreak data to NORS, and NORS will collect epi and lab data. So the difference between these two is that NEARS, it is voluntary and it collects the environmental health piece of a foodborne illness outbreak. And sometimes we are able to put that data together to get the epi lab and EH part of a foodborne illness outbreak and just have a comprehensive view to do analyses. So I'm going to go over the NEARS data collection and reporting process, and this is going to explain how we go from an environmental assessment to identifying environmental antecedents. So first we'll start with an environmental assessment, and this is how the environment contributed to the introduction or transmission of an agent. Basically, this is the NEARS tool. So part of the NEARS tool is an observation of the kitchen and a manager interview, and then the investigator will also collect just general characteristics of the establishment, and they use all that data to determine a contributing factor in environmental antecedent, which I'll get to in a second. So just as we move through these images, I'm going to provide an example. So let's say a health department suspects an outbreak. The local health department will go investigate it at the restaurant, and they'll conduct the observation, the interview, and do the full assessment to complete the NEARS form. So after they've done the assessment, they'll identify a contributing factor, and these are practices that likely contributed to the outbreak. We do have a predetermined list of contributing factors, and they are split into 3 categories. So contamination, proliferation, and survival. There are also other categories in case there's a situation outside of those predetermined factors. So continuing on that example, let's say that local health department is investigating the suspected norovirus outbreak. They may find that an ill food worker had bare hand contact with food, and that was the contributing factor to the outbreak. So moving on to environmental antecedents. So these are the root causes of the outbreak. You can kind of think of a contributing factor as the what contributed to the outbreak, and then environmental antecedents as why. Why did the outbreak occur? So if there was an ill food worker implicated in the outbreak, that contributed as the contributing factor. An environmental antecedent might be that the worker didn't have paid sick leave, or that the manager couldn't find anyone to cover their shifts, so they worked while ill. So just like contributing factors, we have a predetermined list of environmental antecedents, and these are theorized from the NEARS data and just food safety trends. So they fall into 5 categories: people, equipment, economics, processes, and food. And within each category, there are some subcategories that are going to pop up on the right. And again, this is a predetermined list in NEARS, but you do have the option to write in an other. It doesn't happen a lot. Most of these are pretty common situations from outbreaks. So let's start with people. We'll go through these subcategories: the lack of food safety culture, lack of employee training on specific processes, lack of oversight, language barrier, high turnover, and low or insufficient staffing. So next is equipment. We have 4 categories here. So insufficient capacity of equipment, lack of preventive maintenance, improperly used equipment, and poor facility layout. For economics, it is lack of supplies needed for operating the restaurant and lack of sick leave. For processes, insufficient process to mitigate the hazard. Employees or managers are not following the facilities process. And then food is not treated as time and temperature control for safety. All right, so now we can get into the data. So we use NEARS data from 2017 to 2020. I thought it would be interesting to include 2020 because we get a little bit of the effect from the pandemic. So we included outbreaks that reported at least one environmental antecedent. And to report an antecedent, you need to report a contributing factor. So kind of think of it as a branch on a tree. If you report a contributing factor, you can report however many environmental antecedents for that contributing factor. It doesn't happen a lot that multiple contributing factors and antecedents are reported per outbreak, but it can. Investigators have the option to do that. The data set includes 27 state and local health departments, and there were 509 outbreaks. So you'll see on the right, there is a graph of outbreaks per year for this data set. The most were reported in 2018, that was 189. And it's not surprising, 2020 had the least, and there were 60. Just an interesting fact, if you guys haven't seen a lot of data yet, we had 94 outbreaks reported in 2020 to NEARS. And again, it's voluntary. It's not going to capture all the foodborne outbreaks in the United States, but it was a little higher than I thought. So that's encouraging for those analyzing data. All right, so here are environmental antecedents by year. As I mentioned, there are 5 categories for environmental antecedents, and they're on the left in the key: people, processes, equipment, economics, and food. As you can see, each year, the people category is much higher than the others. We'll kind of dive into that later, into which subcategories were really high. And each year was followed by processes. And then something interesting in 2019, it kind of flipped, which was more commonly reported. It was economics over equipment, unlike the other years. I'm not sure why. I would love to dive into that or hear your thoughts if you have any ideas why that's flipped for 2019. Okay, so here are the most reported environmental antecedents, and this was overall, this isn't by year, although I think this did stay true to each year. So this follows the color coding of the last slide. So these first 3 are from people. It's the lack of oversight of employees, enforcement of policies, lack of training of employees on specific processes, and a lack of food safety culture. And then the 4th and 5th most common are from the process category. employees or managers are not following the facilities process, and insufficient process to mitigate the hazard. Okay, so here are environmental antecedents by pathogen. Now, for the full analysis there, we looked at 17 pathogens. It's quite a hefty table. That's for the manuscript. Today, I'm just going to focus on the top 3 most reported pathogens, which is norovirus in the viral category, and then salmonella and Clostridium perfringens in the bacterial category. So here are the first, second, and third most common antecedents. As you can see, they're all the same, but for the first and second, between viral and bacterial, they are flipped. But overall, they are, all the top 3 are the same. So to kind of pick out some of the unique differences between these categories, we're going to look at the 4th and 5th most common antecedents. So I kind of grayed out those first 3, and we'll focus on the 4th and 5th. So for viral, for norovirus outbreaks, the 4th most common was employees or managers are not following the facilities process, and that is the 5th most common for bacterial. And then the 5th most common back to viral is lack of sick leave or other financial incentives to adhere to good practices. And then to move over to bacterial, the 4th was insufficient process to mitigate the hazard. And I can discuss a little bit about this later on. All right, so some of the conclusions from this study: the root cause of most outbreaks are related to people. As you could see, as it was broken down per year, that people category was much higher than the others. And the top 3 antecedents related to people are lack of oversight, lack of training, and a lack of food safety culture. And unique environmental antecedents for viral outbreaks, and that was the norovirus outbreaks, include staff not following the facility's procedures and a lack of sick leave. And unique environmental antecedents for bacterial outbreaks are insufficient and unfollowed practices. I'm going to skip on to my next slide, but if I have time, I have a few more notes later. So my team has made some resources for identifying environmental antecedents. These could be used during an investigation to identify the antecedents. However you'd like to use them, they will become publicly available. What we've made is a snack, a meal, and a feast. And so that's just the size of the document. This first one on the left is a snack. So it's basically a 1-page infographic. It explains all the categories and subcategories of environmental antecedents. You might be able to use this in the field. Again, it's 1 page. It's just a quick guide. And then on the right, you'll see just 1 page from the meal. The meal's about 4 to 5 pages. And so it kind of walks you through, if you observe this, then you can ask this and identify this environmental antecedent subcategory. It'll help you identify the antecedents. And again, this is just page 1. We have them for each category. The feast isn't on here. It is 13 pages. It is very in-depth scenarios, large tables of walking you through how to identify these. And these are in CDC clearance right now. So if you're interested in seeing them or using them, just keep an eye out. We should release them everywhere in the food safety community. Again, they will be publicly available. And I did keep saying that there is a full analysis. We are releasing a manuscript soon. We're going to put that into CDC clearance in about a month. It's going to be a research note at JFP. It will expand into all those 17 agents. We'll also present some more data by year and then also contributing factors. So those are just some big tables if you're interested in a specific contributing factor or pathogen in regards to the environmental antecedents reported. That'll be available in the manuscript. Brenda Lee, do I still have some time? I'm going to go over like a few more notes if I can.
Yeah, I think you have a couple more minutes.
Okay. So just to kind of talk about how some sites have used this environmental antecedent data is in New York City. They actually adopted the NEARS instrument as their official guide to investigate outbreaks. And they noticed that one of the antecedents that was reported a lot was the lack of sick leave. So they've started to advocate for mandatory paid sick leave in their jurisdiction. So people are using this data to try to make policies and practices in their jurisdiction, and it's really encouraging. Just to expand more on The antecedents by year, of course, in 2020, we saw the number of outbreaks and antecedents reported decrease. We think this is likely due to in-person dining restrictions, and then also the increased use of non-pharmaceutical interventions, more use of sanitizers and disinfectants and washing hands. So as we all know, it will be really interesting to see what this data looks like 2021, 22, 23, and on. So I hope to do this analysis again to see how the antecedents and contributing factors changed after 2020. As for contributing factors, it's tough. A lot of these antecedents are related to people and ill food workers with norovirus outbreaks. Our team lead is actually a behavioral scientist. It's tough to change people, right, with burnout and everything. And some of our research, which you can find on our website, supports a certified kitchen manager being present at hours of operation. We've seen that is associated with less unsafe practices at the establishment. And then we would also encourage a proper food safety management system with a HACCP plan and a structure to control foodborne illness outbreaks. And that's all we can really say about, the increase of antecedents in that people category. It's tough to tackle. Okay, I think that's all I have, but I can stay on for questions if there's time. Thank you, guys.
Thank you, Megan. There is a question in the chat.
Okay.
It says, on those people factors, I wonder if there has been thought given to including management issues as root causes, such as management lack of awareness, failure to provide training, failure to train on environmental health policies, or management attitude.
Yeah, it really is just a lack of managerial oversight, a lack of active managerial control. We haven't broken it down past that, but that really is a great idea to look at. And some people might write that into the other category. And if we keep seeing that, that might be another subcategory that we have to add to the people category.
And then John had another comment that said on the management issues that he had suggested above, we've also seen blame shifting by management, which can tend to lead to failure to take action, which I think is a really good point.
Yeah. That's a great point. And we're actually starting an outbreak prevention and response study that asks about kind of the culture behind sick leave. And if, managers are calling on other employees to come in and stuff. So this is just such a topic in food safety now. I'm really excited for my outbreak prevention and response study to take off.
Yes. Any other questions for Megan? Well, thank you so much, Megan. We look forward to seeing the manuscript. I'm really excited to see what it's going to look like by pathogen and contributing factors. So thank you for presenting today.
Thank you for inviting me.
Great. Thanks so much, Megan. So I'll kind of move us into the next topic that we had lined up for today's meeting, which is an overview of FDA's food traceability rule and product tracing demo. I think as probably many folks on the phone are aware, there's been a lot happening in the world of traceability, which will have a big impact on outbreak response investigations. So we wanted to bring a couple folks in to present on that topic today. So I will go ahead and introduce our next two speakers. We have two speakers from FDA, which will kind of be working together to present for you. The first is Angela Fields, who will give an overview of FDA's traceability rule. And Angela is a senior consumer safety officer within FDA's Coordinated Outbreak Response and Evaluation Network, or CORE. And as a member of CORE Response, she provides epidemiologic and traceback expertise in evaluation of data related to outbreaks in support of the agency's response activities. In addition to her role in outbreak response, she does serve as one of CORE's traceability subject matter experts, participating in agency initiatives and providing internal and external trainings on traceability and outbreak response. Following Angela, we're going to have Adam Freelander present a product tracing demo. So I'll go ahead and introduce Adam now as well. But Adam is a policy analyst who is also within FDA's Coordinated Outbreak Response and Evaluation Network. And in this role, Adam helps lead the agency's efforts to advance strategic tech-enabled traceability initiatives and engage with a variety of stakeholders on the requirements of FDA's food traceability rule. Adam graduated from Cornell University with a bachelor's in food science and operations management and a minor in music. And he received his master's in regulatory affairs of food and food industries from Northeastern University. So with that, I will hand it over to Angela to get the next topic started.
Thanks, Karen, and good afternoon, everyone. So as Karen mentioned, I'll be providing a really high-level overview of the requirements of the final rule and kind of just giving you guys a perspective of what's contained therein. So as I'm sure many have heard numerous times, the final food traceability rule requires that persons who manufacture, process, pack, or hold foods that are on the food traceability list to comply with the requirements in FSMA 204. The food traceability rule establishes some new record-keeping requirements for those persons that are covered by the rule. And we really feel that these additional record-keeping requirements are necessary to help FDA rapidly and effectively identify and remove potentially contaminated food from the marketplace. One thing that will be different from what you all have seen previously in Subpart J or the Bioterrorism Act of 2002 is that the final rule covers the entire supply chain. So that would include retail food establishments, restaurants, farms, and it also applies to domestic firms as well as foreign firms that are producing foods for United States consumption. So here you have on your screen is a slide that represents the exemptions that are within the final rule. And some of these exemptions that are listed here are partial exemptions, while some are full exemptions from the rule. And as they're laid out on this slide, we have grouped them together so you can kind of see the commodities that might affect it or the types of industry or pieces of the supply chain that would be covered by those specific exemptions. But I would definitely recommend referencing the final rule to get the full list of exemptions to understand how they apply and who they apply to. So here we have the food traceability list, or as we'll refer to it as the FTL. And so the rule only applies to foods that are on the FTL, and that does include foods that contain the listed foods as ingredients, as long as that ingredient is in the same form as it appears on the list. So as you can see, some of the commodities on this food traceability list are listed as fresh. So if a food item is transformed or changed, if there's a kill step or any other thing happens where it's no longer in the form that it's listed on the food traceability list, then it is no longer covered by the rule. The FTL is published with the final rule, did not change from what was presented in the proposed. So those who may have been following along, you'll still see that the same commodities are listed going into the final rule as well. But we did provide some additional revisions to the description of those commodities to address some of the comments that we received and also to provide greater clarity. So that would include examples of foods that are and are not designated as a part of a certain commodity group. So if you go onto our landing page on the FDA website for the final food traceability rule, you'll be able to identify the food traceability list. And within that drop down, it'll have the various commodities listed. And then again, the breakdown of those descriptions so that you can better understand what foods would be designated in those commodity designations. One other important piece of the final rule is our foundational framework that we're using. So the food traceability final rule identifies the key points along the supply chain where it's most important to collect traceability information. And so we're calling these the critical tracking events, or the CTEs. And those would include the points where the food is harvested and cooled, where it's initially packed for raw agricultural commodities, also where it's first received on land from a fishing vessel for seafood, and then transformation, shipping, and receiving. At each CTE that we have, we're also requiring traceability information that's essential to understanding what happened to the food at that point. And those are called the key data elements, or the KDEs. And this approach really helps standardize traceability information across the entire supply chain. And importantly, the records required at these CTEs would need to contain and link the traceability lot code of the food to the other relevant key data elements. The traceability lot code is such a foundational component of this rule. And so we feel that by tracking the movement of the food by the lot code, it will really enable us and industry to avoid issuing overly broad recalls, which would then limit adverse impacts on industry sectors affected by the outbreaks that we're investigating. So here you see a supply chain example for fresh produce. And this is really to highlight how the CTE and KDE structure works. So this will identify a firm's role and the activities in the supply chain that will then determine what KDEs they must keep and share. So this example represents a very generic supply chain for fresh produce that will be sold at retail. So for example, this could be fresh cucumbers, it could be fresh tomatoes, or even fresh leafy greens. You can see that the specific KDEs required to be kept at each critical tracking event in the supply chain are listed below each point in the supply chain example. So in some cases, one entity may conduct multiple CTEs, and so as a result, they would be required to maintain and share, in some cases, the corresponding key data elements. So for example, the initial packer of a fresh lettuce would be required to keep pieces of information that pertain to that initial packing event. And since that same entity also most likely would ship that food to the next point in the supply chain, that entity would then need to keep the KDEs that are required under the shipping CTE as well. And the shipping CTE identifies those KDEs that must be sent to the person that's receiving the shipment of the food. And since all of these entities are covered by the rule, each entity, including retail food establishments and restaurants, would also be required to maintain a traceability plan, which is again identified within the rule. So here we have a screenshot of an interactive online tool that we have that really highlights the CTEs and the KDEs required. So again, if you visit our website, it'll be on our landing page and you can access this interactive tool. And by clicking through the tool, again, it'll show you which KDEs specifically pertain to the CTEs in a more summarized fashion. So when it comes to the record maintenance, the records can be maintained as either original paper records, electronic records, or true copies. The records do have to be maintained for 2 years unless indicated within the rule. There are some specific callouts within the rule where there are shorter timeframes in which the records must be maintained, but outside of that, all of the records that are required by the rule are required to be maintained for 2 years. Additionally, the records need to be made available to FDA within 24 hours of a request or within some reasonable time that FDA has agreed to. By standardizing this traceability information, along with requiring the records to be provided to FDA within 24 hours of the request, this will really allow for fast identification and rapid removal of potentially contaminated foods from the market, which hopefully will then, of course, result in fewer foodborne illnesses and deaths. So during an outbreak or other threat to public health, we are also requiring an electronic sortable spreadsheet, which must be provided to FDA within 24 hours of the request, or again, within some reasonable time frame that's agreed upon by FDA. which could also include these requests that will be made by our phone. And in certain circumstances, FDA can require that the records be provided to us in an electronic spreadsheet. And these situations would include when it's necessary to help prevent or mitigate a foodborne illness outbreak, to assist in the implementation of a recall, or to otherwise address a threat to public health. And the electronic sortable spreadsheet would not be requested during something like a routine inspection. So we do want to make sure that that's very clear, because we do get a lot of questions about that, and that this electronic sortable spreadsheet is really only for these specific situations that I mentioned, and will not be required to be maintained outside of that unless a firm chooses to do so. So the compliance date is January 20, 2026, which seems far away, but we all know we'll be here before we know it. And so we've chosen this date because we felt that this provided industry time to coordinate effective implementation of the rule, as well as collaborate on the needed tracing systems that would be used to help these firms maintain this information. Consistent with our approach for the other FSMA rules, we do intend to still take the approach of educating before and while we regulate, because again, we understand that this rule is extremely complex. And so we want to ensure that we are not only regulating, but also making sure that we're educating industry so that they can comply properly with the rulemaking. Once the compliance date has passed, we intend to use our standard regulatory inspection tools, which could include discussing violations at the time of our review of the records. We could inform covered entities of the violations of the rule as they're observed, and then provide firms with a reasonable opportunity to comply. And with that, in preparing for the compliance date, we will continue to do outreach with industry and other local, state regulatory entities, tribal, territorial partners, to ensure that as we are taking on this enforcement and implementation and development of materials, that we are not only putting industry first, but also making sure that we're providing industry with the educational materials that they need. We will probably post some other communication materials on our website that will help further explain certain parts of the rule and also provide additional examples. And we're also actively working on developing a way for stakeholders to submit requested traceability information to FDA. And this again is another component of the rulemaking, where we have to develop a traceability portal to accept the information that's required. And so this will allow industry to upload records and the electronic sortable spreadsheets while protecting the confidentiality of the information that's being provided to us. And as those processes, and Adam will talk a little bit about that in his portion of the rule, we of course will communicate when that time comes. So as I mentioned, we are still working on our compliance strategy with our state, local, tribal, territorial, and other regulatory partners. And we're still really considering the best approach for structuring and conducting the record inspections under the rule. We know that this is a big point of interest across industry as well as regulatory partners to understand what our thinking is on implementation enforcement and what our approach will be. And so we are working really hard to continue those discussions and determine what that compliance strategy and plan will be. And again, ensure that as we're moving towards the compliance date, that we're doing the necessary outreach with our other regulatory partners to ensure that that we are all in sync with the approach as well. So I wanted to take some time really quickly to talk about the available resources that we have so that you all have an opportunity to understand and learn more about the rule if you haven't already done so. So of course we have the final rule that's actually on the Federal Register, and I can share some of these links with Karen so that it can be provided to the group if they're needed. But we have the link to the Federal Register, which again will be the final rule itself. As I mentioned, we have a final rule traceability page on FDA's website that contains translations of the rule and then also contains some of the materials that I've mentioned during the presentation. We also have a frequently asked questions page that will allow you to search and identify keywords that will help you kind of understand some of our questions and responses that we've received as it pertains to the rule. And again, with the FAQ page, that is something that is continuously updated. So as we receive more questions, we do update that page to provide some more answers and provide more guidance for folks. We have links to the webinar that we did back in December when the rule first published, so you can watch and get a more in-depth view of the rule and the contents of it. We also have the documents that I mentioned, the exemptions tool, as well as the CTE KDE tool. And then there's the website for the webpage for the food traceability list. And we also released the risk ranking model results, which will allow you to have a more perspective on how the food traceability list was composed and see where some of these pathogen pairs and how they're ranked within that model. We also have additional supply chain examples. So we have examples for produce, seafood, and cheese, and we are working on trying to develop some more supply chain examples to provide to industry to, again, give some more perspective on how we envision the rule playing out. And then most importantly, we have a section for the retail food establishments and restaurants that allows us to really highlight and pull out the information that are specific to RFEs and restaurants so that the industry can have a better understanding of how RFEs and restaurants need to comply with the rule. Again, realizing that this is a newer component since, again, with Subpart J, it wasn't included there. We wanted to make sure that we were providing information so that the retail food establishments and restaurants could understand what the requirements are. And then finally, I want to make a plug for our TAN, which is our FSMA Technical Assistant Network. And this is an area where you can provide your questions to us. So if you are reading through the rule, looking through any of our materials, and you have specific questions that you would like to try and get some more information about, you can submit your question to the TAN and we will respond back based on the information that we can to answer your question. I would encourage that if you are submitting a TAN question to please provide as much specificity as you can, because that really allows us to understand what you're trying to ask instead of having to make assumptions about it. And it can really help us better answer and shape our response based on the context of your question. So I will now turn it over to Adam so he can talk about the product tracing system.
Great. Thank you, Angela. That was an excellent presentation. And I also wanted to say thank you to AFTO for this invitation and for the opportunity to speak more about the food traceability rule and our we're going to provide a demo on an example product tracing system, but just to show you some of what we're thinking about in terms of when we do receive those traceability records, both from firms who are and are not covered by the rule, how we're thinking about collecting that information, processing that information, and ultimately analyzing that information and sharing it with our regulatory partners. So I'm excited to show you this video. It's about 8 minutes, but before I do, I just wanted to underscore the importance of how game-changing this traceability rule is for protecting public health. As Angela mentioned, previously we had to go just one up, one back in the supply chain to conduct an outbreak investigation. And what Angela was talking about with the traceability lot code is that this is harmonizing the language of traceability. It's creating better, more high-quality data within our supply chains. And another key data element that I think is incredibly important is a key data element called the traceability lot code source, or the source reference. And that key data element tells us as outbreak investigators who assign that traceability lot code. So previously, a lot of different critical tracking event stakeholders, whether they were distribution centers, manufacturers, initial packers, even retailers would assign their own unique identifier, their own lot code. So when we're conducting an outbreak investigation, we're seeing various types of lot codes, and that led to a lot of confusion. It wasted a lot of time and ultimately hampered the investigation. So by standardizing this language of food traceability, this lot code information, and having specific rules around who can assign it and who cannot, that's going to lead to more effective and efficient outbreaks. So yeah, please feel free to reach out anytime you all have questions. And with that, I'm happy to share this video demo, which I presented at IAFP Europe a couple of weeks ago, I think about a month ago. And this was a collaboration that we've undertaken with the German Federal Institute for Risk Assessment, or BFR. They created an open source software called Food Chain Lab. And so we incorporated this Food Chain Lab tool for traceability analysis. But I just wanted to put a disclaimer out there that this is not our official FDA product tracing system. This is just an example of what a product tracing system could look like and our vision for the future, but we will keep you all updated as we're progressing in our development of a product tracing system. So with that, I'll share my screen. Give me 1 second. Okay, can you all see my screen?
Yep, we can.
Perfect.
Product tracing systems, or PTS for short, can aid in the receipt and analysis of traceability records provided by industry, particularly during foodborne illness outbreak investigations, product recalls, or other threats to public health. The example PTS in this demo highlights some of these analytical capabilities. Within this demo, we will be using a synthetic dataset centered around a fictitious seafood supply chain. This example PTS has the capability to process and visualize traceability data in both structured and unstructured formats. While this data is not intended to represent FDA's official PTS solution, we do hope to showcase innovative tools that are currently being researched to improve traceback and traceforward analysis, government and industry collaboration, root cause analysis, and other illness prevention efforts. Within this example PTS, users will be able to import, manipulate, and categorize data as relevant to traceability investigation procedures. The investigation platform provides workflows for end users to process key activities in a standardized and automated way. The system supports creation of user accounts with defined permission levels, single sign-on capabilities, data import capabilities from a variety of source formats, including XML, JSON, and XLS, and data visualization capabilities. The leftmost component, the tracing view, provides an interactive platform allowing users to visualize end-to-end supply chain activities and perform traceback and traceforward analysis. The middle component, the interactive mapping view, allows for user input and manipulation of the data elements needed to visualize supply chain events on a geographical map. This component leverages the German Federal Institute for Risk Assessment, or BFR, open source Food Chain Lab tool. The rightmost component, the system dashboard, provides data analytics and reporting capabilities for end users. Before going further into each of this example PTS system components, it is important to provide context on the data ingestion process employed by this example PTS. The data ingestion process is designed for flexibility. Industry or other regulatory partners may submit requested supply chain traceability data via email or through a secure web portal. Data is anticipated to be received in a variety of formats, including spreadsheets, JSON, XML, or scans of other pertinent supply chain documents such as invoices and bills of lading in PDF or other image formats. This data will be stored in its raw format in a secure repository by which this example PTS will source from. To help support interoperability, the underlying backend functionality for many of the example PTS system components is built on the Electronic Product Code Information Services, or EPCIS, 2.0 data standard. For context, EPCIS is a global standard for creating and sharing visibility event data, both within and across enterprises, to enable users to gain a shared view of physical or digital objects within a relevant business context. Simply put, EPCS is a way of standardizing data received from industry and/or regulatory partners to support overall data interoperability. Once the raw data has been received and stored within a secure repository, the example PTS leverages an internal conversion mapping tool that converts the raw data received into an EPCS compliant format that is then stored within an internal EPCS data repository. As an example, the following source spreadsheet will be converted to the equivalent EPCS compliant JSON output file and stored within the system's EPCS repository. Once the data is housed in the EPCS repository, it is now available for consumption by the example PTS. To demonstrate this process, we will show you a seafood supply chain example. Please note, the data used for this presentation is fictional. In this example, we assume that all requested files obtained from industry and/or regulatory partners have been received. For the demo, we have a total of 12 spreadsheets containing seafood supply chain data. Let's go into the interactive mapping component to begin the process. The interactive mapping component of this PTS supports the upload, retrieval, and visualization of supply chain data. Uploaded data can be saved and later retrieved within the system using an assigned unique identifier. Data can also be exported from this example PTS in EPCS compliant format. JSON, XLS, and XML formats are supported for data exports. To begin the process for our example, we will select the input files we want to import into this example PTS. Once we have loaded the spreadsheets into the example PTS, we can see the corresponding nodes appear on the tracing diagram. We now have a complete end-to-end supply chain network diagram represented within the system. Properties of the nodes, as well as their links, are automatically populated based on the input data, eliminating the need to manually create and link the network. Each pin on the map represents a location in which actions and events occurred within the supply chain. For the purposes of this example, supply chain events include harvesting, cooling, shipping, receiving, and transformation events. Users may also manually drag and drop additional pins on the map as needed. Within each supply chain event, data elements are captured and can be viewed and modified by the user. These data elements are automatically populated in the system based on the data contained in the source files used to generate the diagram, eliminating the need for manual data entry. However, manual data entry is still available by the end user when necessary. Additionally, this example PTS automatically extracts master data from each of the source files received by firms used to generate the diagram. This ensures that entities, products, and location data use consistent identifiers within the system, which can aid in eliminating duplicative records and maintaining data integrity. Network diagrams generated within the interactive map view can be exported in JSON and XML format, complete with any manual modifications applied by the user. Now that we have shown the interactive map and its functionality, let's move on to the tracing view component of this example PTS. We will use the same seafood supply chain example here by loading the unique EPCS identifier we previously assigned in the interactive mapping component. Now that we have loaded the EPCS identifier for the seafood example, we can see the corresponding nodes on the tracing diagram. The tracing view serves a similar role to the interactive map that we explored previously, while also allowing for more robust interactive tracing capabilities. The diagram is fully interactive, providing options for the user to move nodes within the diagram and drill down into specific nodes to view the node properties, mark nodes as outbreak related, as well as indicating possible points of cross-contamination or nodes that underwent a kill step. This tracing view utilizes an open source tool called Food Chain Lab developed by BFR to display foodborne illness outbreak information and contextualize supply chain data. What was once a completely manual process for creating traceback diagrams is now an automated and simple visualization tool that can be used to identify commonalities within the supply chain. Additionally, the diagram allows a user to perform forward, backward, and full traces on specific nodes within the diagram. This is a critical functionality of this example PTS, as it enables users to visualize the end-to-end movements of products and/or ingredients for which data has been supplied. This is especially beneficial in supporting the identification of potentially contaminated food products during the response to foodborne illness outbreaks. Design for the system dashboard component of any PTS should be done with end-user needs in mind. During the development of this example PTS, we're utilizing a process of creating and reviewing low-fidelity and high-fidelity wireframe designs, such as in the above example, and to determine which data to display and continuously receive input from end users to help iteratively design a solution that will meet their needs. Development of product tracing systems highlight how information technology tools can support public health efforts by improving foodborne illness outbreak investigations and fostering widespread trust across the food system. From data ingestion to data analysis, this example PTS demonstrates how international collaboration can advance global tech-enabled food traceability processes between governments and industry stakeholders.
Great. Well, I hope that you all enjoyed that video and found it informative. And before I close, I just wanted to just mention that this is a partnership, and we can't do this without the support from groups like AFTO, the state, local, tribal, territorial governments, even the industry's support with this. So we look forward to any questions that you have or any recommendations that you have. We're completely open to feedback. But you know, the most interesting piece to that video for me was that we are going from a manual process of creating traceback diagrams to leveraging the data that we will be receiving from either electronic sortable spreadsheets or even from PDF, JPEG, scanned documents that we receive from firms who are not covered under the rule. So we think that this is a huge, it's a significant step in our efforts to advance food safety, food traceability. And we want to support you all in this journey too. So I'll close with that, and happy to answer any questions. So thank you.
Thanks so much, Adam and Angela, for giving us an overview of the food traceability rule. We have some time left, so I will open it up to see if anybody has any questions for either Angela or Adam on what they covered today. All right, not seeing any immediate questions pop
Hey,
up.
Karen, it looks like
I
Patricia
see
Buck
one.
has a question.
Go ahead, Patricia. Are you able to unmute?
Yes, I am. Thank you. That was amazing. But I don't know everybody on the call here, but it was certainly a little bit over what I got the gist, but I think you need to have more explanation, in particular about how we're going to secure the data. And this is, as far as I'm concerned, a huge problem because the country doesn't even have a data policy. So what is FDA under the EPCIS? Are they sharing more information about how that data is being secured?
Yeah, that's a great question, Patricia, and thank you for asking. I do think you raise an important point about data security, and that's certainly a crucial piece of what we're working on right now as we're building out our product tracing system. That's a centerpiece of everything we do in the federal government, is protecting data, especially the sensitive data, right? So we have specific processes in place within our IT systems to make sure that the data is protected and that bad actors cannot access that data. But in terms of your question with EPCIS, that's actually an open standard. It's just a data standard. So essentially what we're doing is we're taking unstructured data, or maybe even structured data or semi-structured data, and we're converting it into an interoperable data standard. And that data standard was created by GS1 US, or just GS1 generally. So they won't have access to that data. It would just be FDA or other regulatory partners who would have permission to access that information. So does that help answer your question?
Yes, it does. I am a consumer representative, so I'm interested in what the consumer can verify that, that all the steps that are being taken with data is not only secure, but at some level accessible so that the consumers can make their own decisions. And I don't know if the traceability rule is even designed to do something like that.
Yeah, thanks, Patricia. So as it relates to the consumer, there is no requirements that cover the consumer. So the last mile of getting to an RFE or a restaurant is where the requirements would end. We do, as industry continues to move forward in expansion of data capturing and capturing in us being kind of in a technological world where people are, door dashing and Instacart, there are ways that we could access some consumer data, but as it pertains specifically to 204, we don't have any requirements that cover consumers. I will say, though, for the data security piece, we do currently still receive a lot of traceability information from industry. And, aside from FOIA requests, which is the Freedom of Information Act, where folks can request information, we do still work really hard to ensure that we're protecting all the confidential information that we receive. So that will not change with 204, and we will continue to do so by protecting information as much as we can.
Yes, that's very helpful. But again, I think moving forward, one of the big drivers is consumers, because they have a right to choose the products that they feel are safest for themselves and their family to prevent, foodborne illness. And I worked hard on the traceability section, so I'm really excited to see this presentation. Thank you very much.
And I'll put one more plug. We do have a table that CORE maintains online that is consumer facing, that will allow or public facing, I should say, that will allow the public to understand and know what outbreaks are being worked on currently. So again, that's another resource that you can find on FDA's website that will help keep the public informed about what's going on, at least from a foodborne illness outbreak standpoint.
Thank you.
Great question. Thank you. We have 3 minutes left. So if there's any additional questions, we probably have time for 1 or 2 more. All right. I know that was a lot of information to unpack. So thank you so much, Angela and Adam, for presenting on that. As Angela mentioned, there's a ton of great resources on FDA's website about the rules, so we can make sure that we get those links circulated so you guys can check those out. I think that's a great starting point for any questions that you do have. But last call for any last minute questions.
Karen, I think one just popped up in the chat. It says, just wanted to understand what steps are being taken for data security and traceability for online food delivery systems.
That's a great question. So we are working to figure out how we can ingest and receive information as it relates to covered entities and their requirements for 204. And like I said, we're still working on a lot of those strategies about how we're going to intake information, where that's going to be, and just in general, what compliance looks like across the board. So there'll be more information available as time goes on, but that is definitely something that we're taking into consideration as it relates to the online food delivery systems.
Yeah, and I'll add, similar to what we were just discussing, we are going to take steps to either have data submitted to us in a secure portal, or with, people may be able to send email attachments if they're using a government email address, or even industry sending information to the government. Then we're going to protect that data. So as Angela mentioned, the rule covers from the point of the farm all the way to the receiving dock at a retail food establishment or a restaurant. So it doesn't cover that last mile. So that's the, if you're an industry constituent, then making sure that you have the IT infrastructure in place to secure that data is incredibly important, just as it's incredibly important to protect the data from the government side too. Thank you.
Great, thanks, guys. All right, it looks like we're just at 2 o'clock now, so I'll just say thank you all for attending our committee meeting today, and a big shout out and thank you again to Megan, Angela, and Adam for presenting this afternoon. We look forward to continuing the committee charges into next year, and I'll just give a plug that if there's anyone out there who is not on AFTO's Foodborne Outbreak Emergency Response Committee and you would like to join, we certainly welcome additional participants. Brenda Lee, anything else you wanted to add?
No, I think that's great. I just wanted to echo that. Thank you to our speakers. That was wonderful.
All right. Well, with that, thanks, everybody. Hope you have a great afternoon.
Thank you. Have a great day.
Bye.